Hi everyone, welcome back to my YouTube channel. Today we are going to talk about sphenoid bone, and here at the side you can see the diagrammatic or schematic representation of the skull bones. And the yellow color bone just anterior to the temporal bone, that is blue color bone, is the sphenoid bone. And now we are going to talk about that. So let's start our topic with introduction. Sphenoid bone is one of the most complex bone of human skull that is situated at its base. It serves as the keystone of cranial skeleton because it articulates with multiple other skull bones, contributing to overall stability and functionality. Sphenoid bone is essential for brain protection, structural support, and housing key neurovascular structures. Now let's talk about location of sphenoid bone. Sphenoid bone is centrally located within the cranial bones, connecting with frontal bone, temporal bone, parietal bone, occipital bone, ethmoid bone, and facial bones. It spans across both sides of the skull, providing support to the brain and forming part of orbital and nasal cavities. Now let's talk about the structure of sphenoid bone. Anatomically, sphenoid bone consists of several critical components. These include body of sphenoid, that is the central portion housing the sphenoidal sinuses, which help in air filtration and voice resonance. Second structure is greater wing, that are the large lateral extension contributing to the sides of skull and forming part of orbit. Next component of sphenoid bone is lesser wing, that are small projection forming part of orbital roof and helping protect the optic nerve. Next feature is pterygoid process, that is tension pointing to downward, serving as attachment site for muscle involved in chewing and swallowing. Now let's talk about anatomical features of sphenoid bone. Sphenoid bone consists of several vital structures. The first is sella turcica, that is a saddle-shaped depression housing the pituitary gland, which regulates endocrine function. Second feature is optic canal, that is a passage for optic nerve enabling vision. Third feature is superior orbital fissure, that is opening for nerve controlling eye movement. Fourth feature is foramen ovale and foramen rotundum, that is opening through which important neurovascular structure passes. And next is sphenoidal sinuses, that are air-filled cavities contributing to respiration and skull weight reduction. Now let's talk about function of sphenoid bone. Sphenoid bone play several essential roles in human anatomy. It includes cranial stability, that it acts as a central support structure connecting multiple skull bones. Second function is brain protection, as it shields critical brain areas including the pituitary gland. Next function is vision assistance, as it forms part of orbital cavities and provide a passage for the optic nerve. Next function is muscle attachment, as it supports muscle involved in chewing and swallowing. Next function is sinus function, as it contains air-filled sinuses that aid in breathing and reducing skull weight. Now let's talk about clinical significance of sphenoid bone. Sphenoid bone is highly significant in neurology, endocrinology, and craniofacial surgeries. Due to its location, fractures can lead to vision impairment, nerve damage, and pituitary dysfunction. Sphenoidal sinuses are prone to infections like sinusitis, which may require treatment. Additionally, abnormalities in sella turcica can indicate conditions. Abnormalities in sella turcica can indicate conditions such as pituitary tumors affecting hormonal balance and bodily functions. Next is surgical procedure involving the sphenoid bone include endoscopic sinus surgery and transsphenoidal surgery, which allows access to the pituitary gland without opening the skull. Now let's talk about conclusion of this lecture video. Sphenoidal bone is a structurally and functionally essential component of skull. Its role in cranial stability, neurovascular function, vision, and sinus function make it crucial in human anatomy and medical sciences. Understanding its structure is vital for diagnosing and treating cranial and neurological and endocrine disorders. And this was all about sphenoid bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.